You're listening to the Future Tech Podcast with Richard Jacobs. Future technologies such as artificial intelligence, stem cells, 3D printing, gene editing, Bitcoin, blockchain, the microbiome, quantum computing, virtual reality, and exploring space are much closer than you might think. In fact, many early versions of these technologies are in play right now, and the companies that are using these technologies are the focus of this podcast. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a thorny medical problem. Remember, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you've enjoyed the podcast, please listen, subscribe, like, and tell your friends about it. Thank you. Hello, this is Richard Jacobs with the Future Tech and Future Tech Health podcast. My guest today is the co-founder of Visom Tech, Visomtech. That's the website, visomtech.com. His name is Sean Buchanan. We're talking about AR and surgery, augmented reality and surgery, which sounds really cool. So, Sean, how you doing?
Good. How are you doing today, Richard? Thanks for having us on.
Yeah. Well, unfortunately, probably no one wants to have surgery, but a lot of people have to have it. So, how is augmented reality going to improve it and change the experience for people?
Yeah, we're really excited because when it just comes down to it, surgery is just not as safe as we think it is. We can't see inside the human body the way it's made or it needs to be seen. And augmented reality provides a great avenue to better patient care and outcomes through that way. And we're really excited about it because we know we can have a high impact and really simplify surgery for everyone. We know that surgical errors, considered the third leading cause of death in the United States, it costs about $17 billion per year, and we know that 75% of surgical error occurs during the surgery. And so by providing and making a 3D visual assistant, we can simplify surgery so that way the student the right way.
So what's an example of how it would work? Let's say I'm doing, some work on the heart. Would I wear goggles that project onto my field of vision?
Yeah.
The different parts of the heart, for instance, like how would it help?
Yeah. So let's change from the heart to the brain, because that's where we're starting. This idea came from my college roommate, who is now a neuroendovascular fellow at the University of Washington. And so what we use is the Microsoft HoloLens. It's an absolutely amazing product. And we chose HoloLens because of the stability of the hologram. And so for the use cases for what we're looking at this, what we're doing is from a patient education standpoint, we're starting with models and then moving into the patient-specific brain, but they would be able to see their tumor, and then the surgeon would be able to walk them through of what he's worried about and how he's going to de-risk that, where he's going to make his cut, all those different things. And what's helpful about our approach in our secret sauce is that right now you're looking at 2D images, and that translation to 3D is really challenging. So this is just provides a platform to make it a lot more intuitive and collaborative.
Well, would this be for the patient to see, or what about the surgeon themselves? If they have a tumor that has a certain morphology, wouldn't they want to look at it and rotate it in 3D? So when they go in there, they go, "Oh yeah, I know where we're going with this thing."
Yeah, great question, Richard. What we found is that we've built a flexible 3D visualization assistant that can be used a variety of ways. And so that's one feature is from patient education. But the other application or feature that we're looking at is for pre-surgical planning. And so since it's been really cool, it's been something we've learned that they gravitate to more. But a surgeon would look at a patient-specific anatomy of a tumor and look at how he does his planning for his case or de-risk it down. And what's cool is they're blowing up the hologram to the size of a room. So then that way they can walk through the patient-specific anatomy hologram of the tumor and see what is occurring in the tumor around it. And so it's a big step up for them, because right now they're either looking at that 2D MRI or they are playing with a 3D brain, and that's great, but you can't get into what are those gotcha areas that they're really worried about, and they they need every tool that they can to de-risk down for those hard cases.
Well, I guess from a regulatory point of view, there's probably very little, if anything, for the surgeon to at least view beforehand and do a walkthrough of the surgery versus using it during the surgery. So are you segmenting it that way? Is that why you're talking about this part of it, because there's a much lower threshold of adoption?
Yeah, it's a great insight there for the way we've been telling our story, Richard. We've always been concentrating on this from an interoperative standpoint. I myself have been obsessed with computer vision and how that heals the human body for 7 years. We were looking at the Xbox Connect with kind of high frequency seizure movements to see what you could get. We knew that the hardware was there where we could get close. And so our secret sauce is we can look at the patient and overlay that in under a minute and with millimeter precision accuracy into a different use case that's patient bedside. Right now, they don't have any tools. Right now, they're just using that 2D image and trying to jam a knife or a size of a 1 millimeter in your head to relieve the fluid pressure from your brain. So there's that opportunity there, but we know we need to get this interoperative because that's going to make the biggest difference for the surgeons. And with the HoloLens 2 coming through, we're very bullish on our technology and what we've built and what we can accomplish into that. So you're right that we're focusing on getting interoperative, but in working it back, there are a variety of ways that having this 3D visualization, we can start getting this into the hands of users and start understanding how we can help them and assist them better.
And so are you at the point where surgeons are using this and then going to do the surgery and giving you feedback?
Yeah, so we have identified our first 3 users and are working through with soft launching with them. We're closing a pre-seed round currently right now to be able to ramp up our capacity to meet those demands. But we're located out of Seattle, Washington here, and we're launching this fall with Dr. Abhinit Chaudhary at Overlake Hospital with the patient education, with that patient education feature I mentioned. And then we'll be launching this winter at the Medical University of South Carolina with Dr. Eskandari, where we'll be doing a feasibility study into this for the image alignment. And then just as recently as in the last week, we've been working with Dr. Alan Ho from Stanford, and we'll be applying this fall and then looking in the winter to be doing that specific patient bedside image alignment that I mentioned a little bit earlier. So we're almost
super
there yet.
Important. Yeah, this is not just for it's not just for surgery or patients. I mean, research in a given area would tremendously benefit from this. If these images were able to be, pseudonymized or anonymized and released by so first of all, the patient I could see would have a whole set of rights created around the imagery of their body. And they could give this or license it or whatever to science and research. So it'd be a whole other dimension of research for people to see all the various organs and literally their morphology in a 3D view and walk through them. And there's just a lot of places this could be used.
Yeah, there's actually about 200,000 academic research papers that we've seen of research and academics looking into this space. It's something that everybody's been excited about for a really long time. And the breakthrough of what we've been able, and I'm very lucky to be part of, because my team is they're creative, they're geniuses really. Is being able to recognize a patient within a millimeter precision accuracy and be able to do that in under a minute, and a standalone device hasn't been able to be done before. And so we believe that this is the major tip of the spear of a kind of a tipping point in terms of the technology that we've seen interest for, and then what people have been really needing and wanting. And then with this, it leads us into a clear path where we can really get into the really amazing things that we've been kind of circling around with, but we haven't really been able to get there because, we need to get this at a point where any surgeon at any area of the body can look and then be able to have this X-ray vision, and then be able to then get some support into what's some further data and knowledge that we can provide insights for you. So then that way that the cards aren't stacked up for them, where they're having and being overwhelmed by all these things that they're trying to do when they're saving a life.
I mean, there's literally should be a part of medical training. This should be Grey's Anatomy add-on.
Yep.
Everything should
Yeah,
be image like this and accessible.
And I love that you say that because I view myself as hopefully just someone who's just spreading the word, but we're seeing a different kind of surgeon coming through today. The standard of care today will not be the standard of care tomorrow, and this new generation of surgeons have been working with technology their entire lives, and so they need the help with this, and so we see so many applications for it, and I know that out there in America, there's probably 100 things that could be companies that could save lives tremendously, because we're not seeing enough innovation in the space. It's people aren't using the principles that have been proven in the other areas, and we can get these technologists to connect with these physicians who are geniuses and just need the right technical expertise to help make their dreams a reality. Just the sky's the limit in healthcare right now, and where we're seeing the hardware right now is it's unreal with what it's accomplishing, and we just need more help of more talent in this area, and that's what I'm hoping to spread the message today. And I can't thank you enough for your help with this, Richard.
Yeah, no, I've actually thought about this for a while, but are there even libraries of normal functioning of inside of the body instead of just like 2D images? The beating heart, or a fly around or fly through of the heart, for instance, or the brain, or do those things exist?
Yeah, they do exist. I mean, there's and that's honestly a world. There's a lot over. We're focused on down the road. Or looking at this is CT scans and MRI scans are going to be the higher quality images that really help drive a surgeon in terms of what they're looking for. At least that's what I've learned.
So my guess is that the normal morphology, a surgeon, for instance, should use what's normal in their training and look at that, and then they should get the CT or MRI scans of their particular patient rendered into 3D, compare that to, let's say, normal morphology, and they can see literally what's going on, what's changed, what could be affected that's next to what they're working on, for that particular patient, and what's normal. And that would probably be the full suite of what they can see.
Yeah, training's another great area. We know in conversation with the Mayo Clinic that it's something that they're really looking at, taking it to expanding into augmented reality in a VR situation. Really, the sky is the limit in this area, and we're seeing some great people and players that are out of the space addressing this need. Where we're just excited about is we believe the most important and valuable data in the world is seeing what a surgeon sees when they operate. And so all these different great varieties of ways that surgeons have pulled from us that we've been able to find a way to that's a little bit of lesser technical challenge to be able to provide these great use cases to them that will be a tremendous benefit to the patient. But the goal is to get this where you can have a heads-up display or HoloLens or whatever it might be, and they'll be able to see through the patient automatically, and then be able to then automate a lot of those highly repetitive decisions that they have to make on their own, interpret on the fly, that we could give to them in a more assisting manner. But you're absolutely right on the training standpoint. It's an area we're looking at. It's just we're focused on what we think could be a little bit more high impact, respectively, to everybody else that's looking in those spaces.
You know what I like about what you're doing is you're not waiting for AI. I hear that all the time. Well, AI is needed to interpret this or do this or that. So we're gonna, once that's here, we'll do all this. But you're just doing it anyway and using the human component to help it along.
Yeah, I would say as a technologist, what I've learned of looking into the space is shocking to me. I don't think that there is a premium product experience in healthcare right now. And I think that in our healthcare workers, surgeons, nurses, everybody, I mean, these are our superheroes. I mean, they are literally saving lives and healing us. And it's just, we want to be able to help them in any way. But as we break that down, we can see some very low-hanging fruit that's there by just applying transfer learning from stuff that's already been proven in other areas that we know that can really have a high impact and help people out a lot.
So what's your path to implementation? You mentioned a bunch of doctors that are going to be using it, but what's the timeline look like for the next year or so?
Yeah, so in the next 6 months, we'll be launching with those users and closing out our rounds so we can ramp up our engineering capacity. to meet those users. We're always looking for more early adopter innovators to speak to, so we can learn about different areas outside of the head and into the other areas of the body, so as we can move this forward way longer term. But in the next 12 months, we'll apply to the FDA, and we'll be cleared through or close to that, and be able to be really commercializing this. And I would say we've learned a lot about our users, and we're moving into the next stage of really just getting crystallized in terms of the value and how big of an impact and how quickly we can go with this. But we're very bullish on the area. We know that healthcare is changing. It's still slow, but we can really see a movement that's going on right now. And we're excited because we just see a lot of people who are tackling really complex problems that need to be addressed. And we're excited about where we're at, and we're excited about what we're seeing in the market as well.
What are going to be the metrics, though? How do you know? Like, a surgeon can tell you, oh, yeah, I really liked it. But what are the specific metrics that you've come up with them? Which will tell them and you it's better.
Yeah, from a business standpoint, we know we need to get into anywhere from 10 to 20 hospitals, but we know we need to get to 10 evangelists. And we're confident about 3, if not 5 of them that we have right now. But into getting into their hands and then really being able to validate out the data that we see of our tech advantage, that we have benchmark data, but what we're doing is disruptive. So we don't have those specific studies yet, but we have some benchmarks against it. And so those are the metrics that we're looking longer term, in the next 6 to 12 months versus very short term. In the next 6 months, we'll know how much this increases patient satisfaction. Of being able to see their, with these models in 3D, and then we'll understand of the usability from a surgeon standpoint with this image alignment. And then we're really excited because we know that surgery needs a lot of help patient bedside. They don't have many, if any, visualization tools over there in the way that they need. And so we're at Stanford with Dr. Ho, we're excited about proving out where we can start helping there too.
I don't think you'll have a problem with the doctors, because once you have a hospital that says, all right, we're using this, I mean, that's a huge competitive advantage. I would much rather go to a surgeon that uses this. If they were smart, they'd market it, than someone that doesn't, any day.
Yep, you just said a line from our go-to-market strategy, Richard. We believe that, but we know that we need to prove this out with the studies. We're surgeon-centric. We have an evidence-based medicine approach, and so we know that we're pre-launching and soft launching, and as we get that, we're excited about what we're going to be able to help out from both the user as well as from the buyer standpoint. We see this as one pinpoint into a very massive, complex problem with healthcare, but we know that we can help make surgery safer and more in an efficient manner. So that is a little bit more valuable.
Oh yeah. Well, I'm excited to see what the surgeons experience and how much it impacts their ability to do surgery well.
Yeah, can I tell you a story and just the expansion of a little bit of
Sure.
Of one thing? Yeah, so for patient bedside, I'm a terrible driver, Richard. I can't wait for autonomous vehicles. But let's say I get in a car accident and my brain starts swelling. Right now, when they are trying to relieve the fluid or pressure from my brain, they're looking up at a CT scan, an MRI scan, and they're looking for landmarks, and they're trying to translate that 2D image into 3D. And it's like stabbing a 1 millimeter straw in a brain that you have to get in one stroke. And that translation from 2D to 3D is hard, especially when it's a complex case.
Oh yeah.
And so, that is where we could see a great impact area in this, and it scares me of seeing the standard of care of today in certain cases where you just know there's technology out there in other areas that could just help them. And so it'll be, yeah.
Well, maybe this also can improve the "tell me where it hurts" question. If someone can point to something, if I can get a scan of myself in a particular area and point to it, this little crevice area over here, I think, is where it hurts.
Yeah.
Or let's say I could even touch my head and there's an overlay of some interior part of me, and I can move my hand like over my head and, near my temple, and this is where it hurts. Stop.
or this is where I feel pressure, it would probably give everyone a lot more information about what's going on.
Yeah, and I mean, again, it's so exciting, but I would ask you and anybody is when have we ever had a computer with eyes that has been able to help us record and turn into numbers of how we heal the human body? And it's the opportunity,
true.
You know, and it's the opportunity for it is we just need to get this on people's heads in a way that helps them and it's intuitive so they can continue to use it. And then we can start understanding those things. You know, you bring up that point when we were originally looking at this, we were going to try to look into if you could get into early detection for seizures with the Xbox Connect. And so it's an area that we've been bullish on, and what we can't be more excited about is just we know the timing is right. And in that case, if the timing is right, it means that we can really make an impact to healthcare. That's high impact on a low cost model that can really have a significant runway.
Yeah, that's great. And legend has it, a lot of people are visual, so this plays right into it. You know, this will be a huge boom once it's active.
Yeah, it's fantastic of how it helps simplify it down and really kind of open up a discussion where anybody can have a more collaborative talk about it because it's just easier to understand.
So it's, you know, unfortunately, it's not ready for people to say. For people to ask their surgeon, hey, to go use your system. But in the meantime, like, what are some resources for people? Are there AR or VR libraries, or at least 3D libraries online where people can look at, you know, different parts of the human body, for instance, to at least start to get a feel for where this can go?
You know, there's some great people out there that are working on the market, you know, I know some of the areas that they're implemented in hospitals on, but it's pretty limited, I think, to the metropolitan areas. I would say, just in terms of resources, it would more be a question of help to everyone, of helping create a dialogue and a movement in this area, because for AR in healthcare, there are a lot of physicians who are excited about this, but what would help us get it quicker to provide more resources is getting people to ask about it or you know, create more of a dialogue and demand into it. Right now, you know, for you and I, or people who are really in the cutting edge of technology, it's a little bit more intuitive, but we're a smaller subset of a larger population. And unfortunately, you know, it's strength in numbers at that point.
So the best thing people could do now is ask their doctor, hey, do you have 3D vision of my problems? You have AR of my problem or my surgery? And the doctor will say, well, no, it doesn't exist. Or I'm sure they're working on it, but it'll put the bug in their ear, literally.
Exactly. It's about creating a movement right now. I mean, we're starting to see it with all these smartphone apps in different areas. I mean, I know this fantastic Tony Law, who's over at the University of Washington, ears, nose, and throat, that has a fantastic smartphone app that he's developed on the side. I mean, there are people out there that are small and tiny and mighty that are starting to try to help create a movement for healthcare in a variety of different ways. But healthcare is big. It's got a lot of problems, and it's a complex thing. But where we can really help out as patients and the population is, you know, drawing the attention to our providers and the hospitals, so that way we can understand, you know, where we can all move together to help make this a safer place.
Well, very cool. So what's the best way to get in touch with you and your company? Should they go to the website?
Yeah.
Or, you know?
Yeah, we have the website that you mentioned. That's great. It's visomtech.com, visomtech.com. We have a Twitter account and LinkedIn. You know, I mean, we're early stage up enough where you know, anybody can reach out to me on email at sean@visomtech.com. But we're looking for people like you, Richard, that are interested in this. And we're excited about where we can take it. But everybody needs help when they're in early stage, right? So we're tiny and mighty, and we have the grit to disrupt, and we know we'll get there. But the more help we can get, the better off we can get this into people's hands.
That's great. Well, Sean, thank you for coming. This has been a really cool call.
Yeah, I've loved your questions, Richard. They were gangster. I might have gotten a little bit too ranty there, but you know, you have some great things that we're just all so passionate about.
Oh, you're fine.
You're listening to the Future Tech Podcast with Richard Jacobs. Future technologies such as artificial intelligence, stem cells, 3D printing, gene editing, Bitcoin, blockchain, the microbiome, quantum computing, virtual reality, and exploring space are much closer than you might think. In fact, many early versions of these technologies are in play right now, and the companies that are using these technologies are the focus of this podcast. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a thorny medical problem. Remember, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you enjoyed the podcast, please listen, subscribe, like, and tell your friends about it. Thank you.